This video is just going to spend 2 minutes going over how to actually use the bed management module. As with all Command Center modules, we split the page into 4 columns. The first column is solely dedicated to showing occupancy. So you can see we've currently got a 58% occupancy, and that is then split down by wards. This is just some demo data within this dashboard, so it's not real clinical data. We can filter by site, ward, bed type or ward type to filter this down further. On our second column, we've shown available beds. So this is designed when you've got you've got a patient in mind and you want to find them an available bed. We can see we've got 13 medical beds or 17 surgical beds. If you've got different types of beds, we can obviously customize the dashboard to suit those, and we can fully configure all these KPIs and indicators to suit your bed needs. With all Command Center KPIs, you can click into them, actually see where those 13 available beds are. We can flag them whether they're expected today, what site they're in, their status now. And again, we can flag to see where those surgical beds are as well. So those 17 surgical beds, where are they? And we can click in to view that, and we can download those to Excel if we want to do that. We can also, as with all KPIs from the Command Center, click on the question mark, and that gives us more information on that KPI. Here it gives us a breakdown of specialist and general beds by wards, and we can start to drill down into those to find out where the available beds are. Again, coloured by if it's a surgical or medical ward. Third column is on closed beds, and what percentage of our beds are closed and why are they closed. This enables you to find bottlenecks within your system. And again, you can click in to find where the closed beds are. If you track if your bed is expected today, we can actually view the beds expected today. It's just doing a refresh. It's refreshing every minute. And so we've got 44 beds expected today. And the final column is looking at stranded patients. What percentage of your patients are stranded? That's having a length to stay over a certain number of days, and where are those patients? So we call them a stranded patient if you're over 7 days, and a super stranded if you're over 21 days. All these can be fully configured using our configuration module, and when we make a change in there, we can just sync it up, and then the change will reflect in the front end. So that's a quick overview of how we use the bed management and bed status module. We can also configure all these colours and indicators to suit the needs of your trust.